Hi guys, I'm Szenan-Balance from TCM School. Hey, today I'm going to share with you, as you can see that here, I have Chinese and English on. I just done the video for Chinese, so I put it here. So 五运六气 to treat dry eye syndrome. Okay, one of my case I want to share with you. So at the end of the video, this video I'm going to share with you some free training, free acupuncture training. So stay to the end, and I'm gonna show you what formula I use. If you're an acupuncturist or Chinese medicine herbalist, and this is going to help you to open your mind, to open your eyes, to see what are the treatment available without seeing your patient. I mean, without seeing your patient, it's not face to face. Okay, so this patient is actually we're using Wu Yin Liu Qi, just online consultation without pose, without seeing tongue. Just simply ask some question and then do the Wu Yin Liu Qi diagnosis. If you're a patient, this is not for you. Don't just look at your practitioner. Don't just take the formula and apply for the patient. It doesn't work. Okay, you have to make the diagnosis. If you make the June fire week, then you can use all the formulas over here. Okay, so make it all clear. Stay to the end. I'm going to give you some free acupuncture training. All right, let's start. Dry eye symptom. Okay, I'm not going to describe what's going on, but you know, the eye is very dry. That is the symptom. Look at that. Now we all have cell phone, screen time, go to work. Majority of the people are using computer now, office. That means that in the future or from now on, it's been happening. The eye disease is going to have more and more cases. Then, as an acupuncturist, I encourage you take care of your eyes and start to learn how to treat eye conditions, because there are a lot we can offer. We can help patients. Right? Now, I want to make clear for dry eye syndrome, we can reduce the symptom very quick. To completely fix the problem, we may not be able to fix all the problem, completely fix it, but we can teach our patient to manage it, how to manage it. As soon as they feel about dryness, they do some acupressure point, and it's gone. Right? And then they can look at the screen, they can do everything, no problem. With Chinese herbs, a lot of cases, we can actually fix it. By fix it means they don't have any problem. They don't have to use any acupressure point. They don't feel anything at all. No dryness at all. All right. This is mainly correcting the constitutions. Okay, to treat the constitutions. That's most important. Again, not every cases we can fix it, but we at least can show up the patient. We can reduce the symptom. Most of the symptom is a little bit. We teach them how to manage it. We give them herbs to take daily. All right. Okay, let's start. The diagnosis over here. Again, I ask question, but I don't make the diagnosis through the question, the information I collected from asking. And I don't look at the tongue. There's no need to look at the tongue. I can't take the pulse because this is online patient. Okay, so how do I make the diagnosis? We use Wu Yin Liu Qi, and currently I haven't got the PowerPoint presentation ready and teaching in English yet. Next month I'm going to teach in Chinese. Okay, this is going to be my first class. So for information, in Wu Yin Liu Qi we have two fire. One we call Jun fire, right? The other one we call Xiang fire. Okay, what is the difference between Jun fire and Xiang fire? So Jun fire is your heart, small intestine when it comes to meridians, right, and organs. Xiang fire is sanjiao and pericardium. Now, Xiang fire also mean 命门 Well, a lot of people don't know about what Ming Xiang fire is, and when talk about Xiang Ming Men, you always go to kidney, right? And that's the organ. When we talk about what meridian do you treat, do you put needle on for Mingmen fire, and you definitely go to, okay, the meridian will be kidney and UB. You know, I want to tell you something. Yes, that's right. Mingmen, it go to kidney, Mingmen fire. But when you treat the meridian, you don't treat kidney and UB, because kidney and UB, those two belong to water. Right? That's the difference. When we treat that, Mingmen fire is in here. Right? Mingmen fire, you treat Sanjiao and pericardium, that is equal to Xianghua. So a lot of people didn't know that. At very first in the school, I didn't know that either. So I always thought Mingmen, kidney. That is dang, not right. Mingmen, Sanjiao, PC. Okay? So I just want to clarify this. A lot of people don't know that. So since we talk about June fire, I hope it's all clear for you. Now, this is diagnosis. Second step, that is treatment principle. Treatment principle, well, simple. Now, fire against metal, right? So now we know the fire is weak. So we tonify, improve the fire, right? Strong the fire. Then we reduce the metal. Simple, right? Metal reduce, fire go up. We improve fire go up, metal reduce. Okay? Now, we can improve Xiang fire as well. Because when we improve Xiang fire, it will improve Jun fire. Right? Because they both belong to fire. They both, in 5 elements, belong to fire, but they are in a different position. Okay? This fire is actually in the kidney organs and also in pericardium organs and Sanjiao meridian and pericardium meridian. Remember, I said pericardium organs, pericardium meridian, and Sanjiao meridian. Alright? That is the difference. You need to hear me clearly. And also, Xiang fire is on the kidney organs, but we don't treat kidney meridian for it. Alright, the reason I decided to, if in the past or in the future, if you look at here, if you okay, why do you just do same diagnosis, you know, Jun fire? Why do you just improve Jun fire and reduce metal and not actually improve Xiang fire? Because in this case, this patient Wu Yun Liu Qi tell me that the weakest is Jun fire. So I improve Jun fire, but also the Xiang fire is weak. But this is not the weakest, it's also weak. Okay? And this is strong. Therefore, I treat Xiang fire as well. Improve Xiang fire as well. Okay? That's because for this patient. For some patient, I only do this. Right? From this diagnosis. Now, we have the treatment principle over here. What is the method? This is treatment method. Right? I choose herbs. Again, I didn't do acupuncture. Some eyes problem, you need to do acupuncture and Chinese herbs as a combination. Some, like this case, only herbs. Acupuncture, no need. I show her how to do some acupressure point, and I'm going to tell you where the acupressure point I show her to do. And some just acupuncture, no need herbs. It works very well. Right? It depends on the patient and the financial as well. Obviously, it's cheaper to take herbs, okay, and more dear to get acupuncture, to be honest. Okay, now the Jun fire, we use 悬浮带者汤 formula. 28 white teaspoon, yellow teaspoon, or you can use gram as well if you want to do that. We use spoon. 八味地黄丸，八味地黄丸香发芽 ，OK， 香发芽。14 teaspoon or gram. 麦门冬汤 reduced metal 28 yellow teaspoon. 2 yellow teaspoon 3 times daily. Okay. And what was the result? Very well. Very well. No dry eyes anymore. But this is the real case. But what happened? The patient complaining about sore eye. Okay, sore eye. What can we do? I said 2 strategy. Number 1, acupressure point. Where local points around here. So I have to do some local point and distal point. And on those, the pain decrease. That's very good. Second strategy. Number 1, number 2. Second strategy. Based on this herbs, I add on other herbs. What herbs are they? Moving blood and clearing the dampness and mucus. That's 桂枝茯苓丸. And 桃红四物汤. Okay, 桃红四物汤桂枝茯苓丸. That move blood, that also improve nourishing blood as well. 桃红四物汤桂枝茯苓丸 moving blood, warm the blood, as well as clear the dampness and mucus. So those are my strategy for this case. When I add on those 2 strategies, this decrease. Okay, I'm waiting for another 2 weeks and then meet the patient and see how the result is. Okay, now below this video or above this video, you will find some link. Again, in the beginning, I said that 567 I haven't got the presentation ready to teach you in English yet. But if you're keen to learn, follow my video. I'll share more. Definitely. I'll share some basic idea for you. And what's the basic? Before you really pay to learn this, you need to know some basic. Otherwise, very difficult. Okay, very difficult. I actually filmed some video already. Okay, in English. I mean, but I want to tell you that I know you probably want to learn this, but it's not the right time for me to teach you yet. But I can offer you some free training for acupuncture. All right. The first one is balance method acupuncture, local balance. Okay. We have free training. You can go down or up, click the link and join. Second, GE acupuncture. Okay, GE acupuncture. Link. You can go and get it and register. 3. This is all free. Those 2 are free. All right. Free. This one is paid. You have to pay. Okay, you make a payment. It's only $10 a month. Okay, and that is the acupuncture Super 10. Only $10 a month, and you're going to learn balance method acupuncture, local balance, and this one we only show you 2 strategy and 1 image and 1 mirroring how to choose the point. But with that one, there's 2 mirroring, 2 different of image, to choose the point, and 6 system to choose the meridian. So there are more value in here. And we also have G acupuncture training, a bit of that in here. And we also have a quick way to treat pain, give you 3 strategies in any part of that. And we also have A to Z disease, how to treat those disease, and including how to treat eyes disease using acupuncture, okay, and bloodletting, all sort of thing. And if you want to join, you have to join very quick. This is US dollar, okay? Because this $10 every month for a lifetime. If you join for $10, start from this month, then you always pay $10. We're gonna increase the price very soon, and then if you drop out of the subscription, you're not going to get the $10 anymore. You're going to pay more. All right. Stay awesome, and I'll see you next time. Thank you. Bye bye.